Prevent, a digital therapeutic that brings world-class behavioral medicine right to your fingertips. If you're eligible for one of our programs, the first step is to complete a profile, upload a photo or stay anonymous if you prefer, and then write a brief hello to your future group. The Prevent experience doesn't live in a vacuum, so we ask some thoughtful questions about the realities of your daily life. That includes current food and exercise habits, social tendencies, even feelings of mental well-being. This is great background information for your health coach, and it also helps us match you into a peer group according to a constellation of factors, including age, BMI, where you live, and even softer metrics like personality type or life stage. We also dig into readiness to change. If you're truly ready, we'll put the best science and support behind you, but the first step is still yours, and you must be ready to make it. You'll then receive a welcome package, which includes a wireless scale with embedded cellular chip that's already linked to your account. Zero setup or Wi-Fi required. Just open the box, step on it, and it instantly sends data to your private profile. The entire program is supported by the best behavioral science, the most engaging design and content, and an approach that integrates seamlessly into your everyday life, where habits are both made and made better. Welcome to Prevent.
Hear in their own words why they should win.
So I founded Omada Health over 10 years ago with really a mission to show the world that it would be possible to create a reimbursable prevention program specific to the area of diabetes prevention. Fast forward to date, just under 1 in 10 commercially insured adults in the U.S. has Omada as a reimbursable benefit in their medical policy. We've supported over 600,000 and growing members in prevention, and we work with over 1,800 self-insured employers and dozens of health plans. I'm proud in that the way that we did this was starting with evidence, which I know will be important to UCSF. We now have 22 peer-reviewed publications, including the largest and only to our knowledge RCT of a diabetes prevention program specific to digital intervention compared to control. Through that, we've been able to create the world's first digital specific CPT code in partnership with the AMA, which has enabled us to catalyze our commercial traction with health plans and employers. Trust that we're not resting on our laurels. We're proud of what we've done, but we aim to continue pressing forward until we hit the millions of Americans in the spirit of someday bending the epidemiological curve in diabetes and other areas.
Health partners with providers to provide services to patients with chronic kidney disease and facilitate proactive detection.
Cricket Health works with nephrologists and their patients to be the eyes and ears for them when their patients are outside of the office. It's an opportunity for nephrologists to do what they've always wanted to do, which is to prevent patients from progressing to end-stage renal disease.
What we are doing at Cricket is so revolutionary in changing the way that kidney care is delivered to patients.
Cricket Health is more preventive. That is the main focus here. We want to prepare these patients to live their best life and to make the decisions and empower them with education.
In other roles, it's more or less on a reactive side. Care for the patient once they've crashed into the emergency room or need dialysis, but this is different. We try to prevent patients from having to go on dialysis at all if we can.
Hear in their own words why they should win.
Hi, I'm Bobby Sapuka, CEO of Cricket Health. We provide personalized, evidence-based care to people with kidney disease so they can live their best lives. Our superpower is understanding that the key to changing patient behavior is fundamentally changing the way in which we engage patients. That singular insight powers everything we do. It's the guiding principle behind our machine learning predictive model that we call Stage Smart, that lets us identify with 96% accuracy who are high-risk patients, even if they have yet to be diagnosed. It also informs our care model, where dedicated longitudinal care teams can create and foster deep relationships of trust with patients. So every patient gets their own nurse, dietitian, social worker, pharmacist, and patient peer mentor. By forming long-lasting relationships with their care team, patients feel comfortable sharing more, and ultimately, they're able to learn more. And it's why we are unapologetically virtual first, creating a platform in which patients can not only immerse themselves in information about their disease, but also interact with their care teams asynchronously and synchronously over talk, text, and video. We're turning the industry standard on its head, no longer asking patients to engage with their care teams or clinicians when it's convenient for the clinician. At Cricut, we make the interaction happen when it's convenient for the patient. The result is a high-touch, deeply interactive model that delivers personalized care to patients who need it most. We think we should win because we're changing what a kidney diagnosis means for the 37 million Americans who manage the condition today. Instead of waiting for their kidneys to fail and start dialysis, which has been the standard of care in this country for 50 years, we're helping kidney patients before and after kidney failure live their best lives. And we're doing it while lowering costs for payers. Better outcomes for patients and lower costs for the system. That sounds like a winning combination to me. Thank you very much.
6 in 10 adults in the US have a chronic condition. 4 in 10 have 2 or more. And 1 in 4 of our healthcare dollars go to just caring for people with diabetes. While others work in silos or offered siloed solutions, we have an integrated platform that helps not only individuals, but also care teams and health ecosystems to make better clinical decisions. It works by connecting them all across the care continuum. Sure, the WellDoc platform starts with an app, offering real-time AI-driven coaching for people with chronic conditions. But it's also connected to a portal for care team and connected to a comprehensive reporting dashboard for organizations to help optimize care across populations. And it seamlessly integrates into existing care models, workflows, and systems, which aligns with our other key differentiator. We partner across the healthcare ecosystem with payers, health systems, and employers to optimize and extend chronic care programs. We also partner with industry leaders in life sciences and medical devices to build first-in-class solutions to solve for complexities associated with chronic conditions. We're further differentiated by our commitment to clinical rigor, our ability to address multiple conditions and comorbidities in one consistent user experience, an industry-leading AI that connects 6 dimensions of health, and of course, the real results we consistently deliver, demonstrating our impact to key vitals like A1C and blood pressure, while also increasing patient engagement, lowering costs, and so much more. And we're being recognized for it by industry thought leaders. Thank you. We are so excited by this opportunity with UCSF and sharing WellDoc's passion for transforming chronic care around the globe.
Hi everyone, my name's Julia and I am the CEO and co-founder of Lark Health. We're the leading AI digital chronic condition management and prevention platform. We're proud to be a covered benefit for more than 30 million people now in the US who are managing and preventing chronic conditions, stress, and anxiety. I started Lark because of my own personal experiences. I've lived with chronic conditions all my life, and it showed me how important 24/7 compassionate care is for managing a really complex condition. Our cutting-edge conversational AI, paired with remote patient monitoring, provides around-the-clock 24/7 unlimited care for those who need it anytime, anywhere. Our company's superpower is probably our tech. We spent 9 years in tech R&D. We invested about $100 million in investment. And that's when we started to achieve clinical equivalent outcomes to live nurse-driven programs. With tech, though, you can really drive up the scale because there's not enough nurses and doctors in the world, and you can start driving down cost. I believe Lark should win the UCSF Digital Health Award because our industry-leading tech enables us to deliver virtually compassionate care at unprecedented scale and cost. And with 2 billion people struggling with chronic conditions around the world, we need much more scale and much lower cost to finally start curbing this worldwide epidemic. We're so proud of the difference we make in people's lives. Thank you so much.
is Faye Ayodele. I'm the CEO and founder of Cancer IQ. We are a company that is designed to help providers better predict, preempt, and prevent disease, starting with cancer. Because today we know the use of genetic information is now standard of care. Cancer IQ is using this data to be able to predict who's at risk, preempt cancer, and hopefully prevent it altogether using standard of care protocols. And despite us actually having the knowledge and the ability to do this, very few patients are getting access to this service. And why? Because today's clinical workflows and processes really don't scale. The traditional genetic counseling process is far too costly and time-consuming and manual. But that's not all. We've also learned that evolving clinical knowledge makes it very difficult to keep up with the latest set of guidelines. So this makes it so that most providers are either skipping this process altogether or referring patients away to other specialists. With Cancer IQ, our goal is to fix that problem so that everyone can offer genetically informed care to every patient who walks through the door. Let's talk about our end-to-end solution. We have a purpose-built suite of applications that are designed to screen and identify patients that are eligible for a genetic evaluation. We've got a tool to actually evaluate patients and streamline that workflow so genetic counselors can spend less time on admin work and more time on patient care. And we also have a tool to help manage those patients over time so that we can increase the likelihood that they actually adhere to their genetically tailored care recommendation.
The CardioCall algorithm identifies the chaotic pulse rates that indicate the onset of AFib. Just listen. The CardioCall app runs seamlessly in the background.
Hi, I'm good, thanks. Will you be joining me for a walk?
During AFib, chaotic blood pulses through the larynx alter voice properties.
Sounds great. I'll bring the dog with me.
The speaker felt nothing, but the app identified AFib. Once detected, the user is offered actionable steps and the option of sending alerts to caregivers. CardioCall's next app for telecom clouds will remotely screen broad populations at risk, including landline phone users. That means we can help prevent millions of strokes just by listening. CardioCall, a deviceless passive solution at negligible cost per end user, providing frequent testing over decades for significant and silent AFib burdens, along with instant access to hundreds of millions of older adults at risk. It's a scalable new dimension in preventive telemedicine that extends and augments other methods. It's CardioCall. Just listen to your heart.
Hear in their own words why they should win.
Talking is a natural daily activity, but voice is not just words. It's a result of a physiological process generated in our body, containing valuable data about our physiology and health. With the right analytical tools, the data is translated to vocal biomarkers of various health conditions that can be detected and tracked simply through your voice. I'm here to tell you about VAM, voice-assisted arrhythmia monitoring, that we have developed here at CardioCall to save and improve lives. VAM is a new analytics and AI-powered platform using vocal biomarkers of heart rhythm irregularities. By using it, we're able to detect whether there's a risk of experiencing one of the most dangerous heart arrhythmias called atrial fibrillation. AFib is the most common and a costly arrhythmia, a key cause of stroke and other chronic diseases, including heart failure, kidney failure, dementia, and more. It is estimated that 1 out of 3 Europeans will develop AFib. The worst part of it is that AFib is a sneaky disease, with up to 90% of the episodes being asymptomatic. That's why the European Society of Cardiology has called for mass screening of everyone over the age of 65. The sad reality is that the current technologies don't detect large portions of the at-risk 65+ population. And yes, The big majority of these complications can be prevented if detected on time. That's why Cardiacol has developed the VAM app for detecting and monitoring AFib through voice user interfaces like a mobile phone that most older adults already use.
Welcome to an introduction to VioCare's innovative dietary assessment tool, VioScreen, a graphical food frequency questionnaire. The user-friendly interface guides the individual through 1,500 graphical representations that cover over 20 different food groups, from which they will select foods consumed at least once a month. The Healthy Eating Index is one of multiple reports generated designed to provide nutrient analysis and ways to improve your diet with simple changes.
Hear in their own words why they should win.
Hi, I'm Rick Weiss, President, Founder, and Chief Wellness Engineer at VioCare. VioCare's mission is to help providers help patients eat better to prevent disease through technology. Our superpower is our web-based, scientifically validated VioScreen dietary assessment technology, which makes the onerous task of collecting diet information fun, easy, and accurate. Patients use a tablet, computer, or smartphone to take VioScreen before seeing their physician. VioScreen uses AI to analyze the patient's diet to create a highly personalized report with up to 20 recommended nudges, from which patients select 3 to 4 to follow to improve their diet. Few physicians have dietitians on staff. VioScreen is an effective and low-cost way for physicians to use dietary counseling to help their patients eat better to prevent or manage nutrition-related chronic diseases such as hypertension, kidney failure, diabetes, and cancer survivorship. Our main differences are VioScreen's data collection methodology, which is based on a proprietary graphical food frequency questionnaire that includes over 1,500 food portion-sized pictures, and the highly personalized actionable dietary nudges included in the precision nutrition analysis. VioScreen accurately measures over 200 nutrients and food patterns. Other tools give generalized advice like eat more fruits and vegetables. They don't leverage the details of a patient's diet. VioScreen looks at the specific foods consumed to identify food behavior nudges to incorporate. For instance, if your fruit score was low and you eat 1 apple per week, one nudge might be to eat an apple 3 to 4 times per week. VioScreen is clinically proven to make people healthier. Geisinger completed a study using VioScreen on 200 hypertensive patients. Patients' blood pressure dropped 6 points and they lost 10 pounds. The Journal of the American Heart Association published paper noted the magnitude of the improvements in blood pressure were substantial, similar to medication and in line with much more resource-intensive feeding studies and lifestyle intervention trials. VioCare should win to highlight our success of helping consumers improve their diets and health cheaply and effectively, and help make VioScreen a standard of care.
In their own words why they should win.
Outcomes for Me is an AI-driven patient empowerment platform that helps cancer patients navigate their care and gain access to personalized treatment options. We're on a mission to improve health outcomes by democratizing access to treatment information and care, empowering patients with the knowledge and resources they need to take control of their care, and engage in better shared decision-making with their providers. we're giving patients a voice in an arena, even though they're the consumer, they traditionally have no power. This is because they're not the decision maker. The doctor is, and they're not paying for the largest portion of the bill. Their insurer is. We're changing this dynamic by putting patients at the center of the decision making. Providers today would need to spend 29 hours each working day to keep pace with treatment innovation that could affect their patients' care, which just isn't possible. We bring that innovation information directly to patients through a free mobile and web app in an effort to reach people and improve health outcomes regardless of demographic factors such as gender, location, ethnicity, and socioeconomics. We meet patients where they are clinically, physically, and emotionally. Outcome for Me has the only direct-to-patient app that integrates with treatment guidelines from the National Comprehensive Cancer Network, the NCCN, a consortium of leading cancer centers. This means that when patients securely provide their medical history and health records to Outcomes for Me, our platform uses AI and machine learning to provide patients with personalized guidance based upon their unique diagnosis and disease stage. This includes treatment options, clinical trials, and potential genetic testing they could pursue. We use AI to translate information that is typically meant for providers into actionable, easy-to-use guidance for patients.
Hear in their own words why they should win.
Recent studies show that decline in cognitive resources, especially relating to executive functions such as dual tasking, motor planning, memory, and attention, may lead to tripping and poor obstacle negotiation. Yet, most existing solutions ignore the decline in cognitive resources as being a major contributor to falls. And this is exactly what we do. GateBetter provides motor cognitive therapy by adding virtual reality to existing treadmills. Our software solution transforms any treadmill into a personalized motor cognitive device. The trainee walks on the treadmill and sees her own 2 feet in the simulation. As she walks, she encountered virtual challenges to practice both motor and cognitive skills at the same time. She practiced obstacle negotiation, decision making, and sharpened her attention by ignoring different distractors. She also receives feedback, including real-time scoring and trends in performance over time. GateBetter is FDA-registered product with over 20 peer-reviewed publications. We have more than 70 systems installed, and we've treated more than 4,000 patients to date. Through financing and non-dilutive grants, we've raised $4.3 million, and by the end of the year, we will have 10 employees in 2 offices. We've recently graduated from the AARP Acceleration Program, which helped us to tune our messaging in the marketplace. We are expecting an A round at the second half of 2023. By then, we will exceed $1 million in ARR, have launched our Get Better for Wellness edition, and advance our research in a breakthrough offering that leverage our technology platform to predict Alzheimer and other neurodegenerative diseases.
State-of-the-art at-home health testing delivered to you. KIT provides you with the ability to complete the full yearly medical exam from the comfort of your own home without the need for a phlebotomist or lab visit. Our smartphone app provides step-by-step guidance throughout the user journey to make it simple and convenient. A blood pressure monitor is provided to measure systolic pressure, diastolic pressure, and pulse. A saliva kit is provided to detect smoking, substance abuse, and other risk factors. A scale is provided to measure a user's weight. A finger prick kit is provided to take a micro blood sample for testing all the common health markers, such as kidney, heart, and liver function, as well as diabetes, HIV, and other diseases. Components used are proven instruments trusted by healthcare professionals. A live agent is available 24/7 to help ensure a successful user experience. KIT is here to help make health testing a modern, simple, and convenient process. Partner with KIT today to help enhance your remote patient care strategy.
Good afternoon. I'm Sloan Saunders, CEO of IntelliHealth, a medical technology company focusing on democratizing and scaling access to effective obesity care. What most people are familiar with is the obesity epidemic currently impacting 74% of the US population and leading or indirectly causing over 200 other chronic conditions. What most people don't recognize is that less than 2% of patients are treated even according to standard of care guidelines. That's the problem that we're solving. To give you a comparison, that number for diabetes is 86%. So where does medical weight management fall? Most people confuse that with the behavior program, but really it's for more clinically significant and medically appropriate weight loss above a 27 BMI with a weight-related comorbidity. Even the new guidelines for bariatric surgery require medical weight management pre and post surgery to maintain a Center of Excellence designation. Our software platform and our corresponding affiliated clinical services arm, Flight, provide this comprehensive solution. Certain organizations who have clinical resources just leverage our software platform Evolve, but other organizations like self-insured employers and payers work with Flight who use our software platform Evolve to deliver this comprehensive care. Our software platform consists of a patient-facing portal that delivers a gold standard behavior program, and our clinical-facing platform has dynamic clinical protocols and medication decision support to help guide clinical management of obesity. That creates a very comprehensive intervention for the patient to actually derive very clinically significant and durational outcomes, where about 85% of our patients achieve a 5% weight loss milestone with a mean weight loss of 10 to 15% depending on the formulary. That is very significant economic impact. Depending on starting BMI, one can actually expect to save upwards of $20,000 on an annualized basis of healthcare costs. And that's been the driving factor for a lot of our customers, from Weill Cornell and New York Presbyterian to Mass General Brigham and Hospital Corporation of America. We've been working with organizations across a myriad of environments, from primary care to GI to OBGYN, and we're starting to roll out very condition-specific programs such as orthopedics with Hospital for Special Surgery, women's health, fatty liver NASH, and really expand who we are collaborating with at present, from self-insured organizations to even pharma and other healthcare organizations.
Hear in their own words why they should win.
Gabby is a revolutionary risk assessment and early detection solution, delivering immediate and accurate results for women of all ages and all ethnicities. With our comprehensive solution of a risk assessment, a personalized care plan, and the Gabby Concierge. So first, a woman learns her risk of breast cancer in the comfort of her own home through our user-friendly app. We provide clinically validated tips along the way to explain why each question is a crucial part of the assessment. We break down questions with supporting details to ensure maximum completion, and 95% of women that start the assessment complete the assessment. Now that she knows her risks, she needs to know what she can do about it. Each woman receives a personalized care plan enabling her to take proactive action. Each care plan is personalized and designed for each unique individual based on her risks. She receives reminders for proactive steps like monthly self-breast exams and annual mammograms. And our AI technology helps update the plan as she takes action. Now that she knows her risks and she knows what she can do about it, she needs help getting there. Our team of expert care coordinators help women navigate the complex healthcare system through every step of the process. They're available 24/7, and they answer questions such as, is this breast lump concerning? Or help navigate you to an in-network provider.
Join us on November 14th for our grand finale at Health in Las Vegas to see the winners crowned.